because it's tied to the march across the nation in adults. Now, I stopped at 2004, but if you look at 1991, you had only a few states that were at about 20% of obesity. By 1996, you had only a few states that weren't at 20%. And by 2004, and the march has gone on, we have got a lot of our states with over 25% of the population are obese. Significant problem. Why? Because it's tied to the same march with diabetes. And diabetes is that silent killer, that thing that progresses cardiovascular disease and lung disease and all kinds of other problems. So we're losing people in the prime of their lives, and it's costing the AARP members.
Thank you.
So what we've got to do is we've got to look at how we rank. We rank 4th in cancer mortality. We've got to look at the AIDS cases. We've got to look at infant mortality. We've got to find a way to make a difference. Next slide. So when we talk about health reform, it brings on significant challenges. One of the challenges is access to care. And in Mississippi, if you look at, while we have a population of over 1 million people, when we look at the distribution of physicians in Mississippi, we only have 246 black physicians in the state, okay, for 1 million population. And data have shown from the Institute of Medicine and Dr. Ruffin Shop at the NIH that there is a greater quality of care delivered when people share common bonds. So we have challenges there. We have challenges. Next slide. So as we go along the day and we discuss the mechanics of the act and how it will work, we have questions we've got to ask. How can we ensure that new opportunities for health care insurance translate into the ability, 1, to get coverage, 2, access to health care for prevention as well as acute care, 3, adequate numbers of well-trained and culturally sensitive health care providers to meet our needs. Important. How do we develop infrastructure, expertise, and leadership, most importantly? By your presence here, you're an identified leader. So how do we maximize the capabilities and the opportunities to work together to ensure success? Next slide. How do we address the challenges of the health insurance exchange? How many people know that the health insurance exchange will only exist in your region when the states agree upon what that set of services will be? Right. Okay. How do we counteract the naysayers who say, who complain loudly about how this additional cost to the state's Medicaid program? Well, I ran the program and I know the cost will go up, but I can tell you that my belief is by having people live longer and live healthier, they remain productive longer, able to contribute longer, therefore there's a resultant decrease in cost. CBO, get a new formula.
Yep.
Okay. So they're looking at, one end they're looking at cost and the other way they're looking the other direction. And how do we convince community of colors to change our lifestyle? Data have shown that most of the problems that afflict us are lifestyle generated. Smoking and tobacco use, excess eating, unwillingness to exercise or inability to, and we have to work as leaders to make sure they get that opportunity. So when we look at things, next slide please, we look at things like this slide I like to use. How many of you can tell if this is a sunrise or a sunset? It looks a lot like the sunset we saw from the boat yesterday. But there's a thought control marker on the bottom of this screen. It says 1100. That is a sunrise taken from the top of Mount Fuji, Japan on January 1st of 2000 by one of my former residents. And he said, Dr. Jones, I'm sending this to you because you've talked to us about the need for change. And in this culture, opportunity comes with the sunrise. And when that sunrise comes at the beginning of the day, it's a unique opportunity. When it comes at the beginning of a decade, it's important to make change. When it comes at the beginning of a century, we have to do something. And when it comes at the beginning of a millennium, it means we can't let this go by. We're 10 years into this millennium and we've got to make this change. Otherwise, we're continuing to do what we've always done. Next slide. And that's the definition of insanity. And I'm sorry, folks, I am tired of being insane. And I hope that the dialogue today, with the questions that we can stimulate, will make a difference, that we can take this march with it and deliver a quality opportunity for long life, healthy life, and successful life. Thank you.
Okay. Thank you, Dr. Jones. We've been joined by Dr. Leonard Weather
who is the current president of the National Medical Association. Dr. Weather is a gynecologist specializing in infertility, fibroids, pelvic pain, and endometriosis. He's a health educator, an ordained minister, a painter, and a photographer. He's the publisher of the Dr. Weather Report, a monthly healthcare e-newsletter, and he's written several books, both on medicine and inspirational poetry. Welcome, Dr. Weather. Are you ready with your presentation?
Yes. I'm just completely floored to be here today. I'm so delighted to be with this distinguished panel. And also I have to disclose, I do have a disclosure, that Dr. Jones is a good friend of mine and was a big brother, I guess you'd say, in a great fraternity. But in any event, I think from Norland.
No, it's not.
From Norlands, that's right. But in any event, I think it's really important that we look at some things. I'm going to kind of halfway address the healthcare reform, but I'm also going to talk about some things I think is really relevant. Talk about the NMA in terms of what we do, what we have been doing, what we haven't been doing. Going to talk about how we can actually enhance our life, how we can, in essence, be better off today than we were yesterday as a people. I might also mention that what we are looking at doing is lowering the cost, increasing life and the quality of life, and having peace and joy. So I think when we finish this presentation, if you extract everything that's been done so far and been talked about, incorporate what I'm going to say, then I think we'll be there. And the last thing before I get started is to say it's imperative that we take time to take care of our health, because if we don't, we'll certainly have to take time to get well. So with that, this discussion today basically centers around the healthcare reform. Additionally, discuss some of the effects of our community, some of the things that you really haven't perhaps thought about recently in terms of how it impacts our community, limb the National Medical Association's major concerns, how addressing them would create a positive effect on health and wellness. If I ask this question, could you give me an answer? Environmental health. Does anyone know or have any thoughts about environmental health? Is that something that's on the radar that you thought about recently? And why is that? Because of the Gulf, right? But it's been there long before the Gulf, and that's some of the things that we need to at least incorporate, embody into what's been going on, because that's a missing piece as we talk about the health of people of color. And as we talk about the health of people of color, it's largely been a function of what we are doing to ourselves, but not looking at what our environment is doing to us. So we have to look at that. Next slide. So with the National Medical Association, founded in 1895, and of course we've been in the business of promoting health and wellness. That's been our mission statement, health and wellness. And we're going to move kind of rapidly through some of these slides here. But Dr. Edward Mazik, NMA leader, the 60th NMA president, he stated half of the U.S. should not be sick and the other half healthy. And that's almost what we're looking at today. Additionally, the NMA was the only organization, national organization, that really embraced Medicare. President Johnson, as a function of that, asked Dr. Mazik to come into the White House to witness him signing the bill, which is 45 years ago. That is the Medicare bill, which is 45 years ago, the 30th of July. The vote, we're so happy, so pleased that President Obama and our legislators, as yourselves, have been able to do what no other administration has been able to do, and that's to pass health care reform. So we're so delighted. The NMA is advocated for that. The NMA is overjoyed about that, and that it will help our people, all people. The bill is not perfect, but it's better than certainly what we had. So as we look at, scan through some of these things, I'll just kind of highlight the fact that by 2019, 32 million people will have coverage. We also, on the other side, have to look at the concern as who is going to take care of the people? Where are the practitioners that are going to be able to take care of them? And they're not there yet, and we need to make sure they get there.